Going to talk a little bit about oral health strategies for patients with sleep apnea. You know, you see a lot of marketing for physicians who are treating a variety of sleep disorders, and dentists have been a little bit behind the curve on this. But what you don't know is that dentists can be integral in the initial diagnosis. And you know, we're specialists with the mouth and the throat and the airway and stuff, and these issues, many of them originate there. So we need to talk about sleep apnea and dentistry. So what are the risk factors? Daytime drowsiness, everyone knows this. Obesity, it's huge. I mean, this may be a factor of losing 10 pounds and all of a sudden, you know, sleep apnea goes away. This is a part of the Bale-Donine inflammatory tree that I showed earlier for cardiovascular disease. And studies have shown a reduction in inflammatory markers, specifically CRP, after CPAP administration. So you get treated for sleep apnea and your inflammatory markers go down. Remember, I showed you earlier, I showed you inflammatory markers going down for patients under periodontal treatment. Okay, so here is another super specific source of inflammation in the body. Now, here is the Bale-Donine tree, because I come back to this whole thing because they are absolutely onto something. These are the components that contribute to overall inflammation. And so periodontal disease is in here, insulin resistance, but right here is obstructive sleep apnea. It is a component of the inflammatory tree. So the dentist needs to participate in this. This is another area of integrated medicine where medicine and dentistry need to talk and exchange information. So possibly, you know, here's the good news. There's some good things that are happening in this space. Now there are some simple overnight sleep quality testing, just something that you can wear. You don't have to go sleep in a lab. It's much less expensive. But the important part of the conversation is this. You need to know the feasibility of having an oral appliance that slightly positions your jaw forward and opens your airway and eliminates sleep apnea. You might be a candidate for something as simple as that versus CPAP. To me, now this is me talking personally, CPAP to me would be a nightmare. The concept of having that mask strapped to my face and sleeping, I don't think the two would work, okay? I don't have any personal experience with it, but I'm saying is, I think the concept of an oral appliance, I would explore that in a heartbeat if I was faced with a CPAP machine. Okay, so there are a variety of oral appliances that slightly position the jaw forward. You know, all of these things can be determined by the dentist. You know, you may have a constricted upper arch. All of these things we look at when we're doing an examination. We look at your arch forms, your tonsils, a variety of things. So the dentist needs to be in this conversation about sleep apnea because there's a good opportunity here that your treatment might be a little bit more simple than what would be laid out with a sleep specialist physician.